It's a pleasure to have you join us today for another rendition of Price Talks, Policy in a Pandemic. I'd like to introduce myself. My name is Gary Painter, and I'm a professor in the school. I also direct the Price Center for Social Innovation and the Homelessness Policy Research Institute. I do research across a broad range of issues where social innovation can impact policy and societal outcomes, but in particular, the focus of today's conversation is to think about homelessness and how this pandemic has impacted those people who are experiencing homelessness on a daily basis. In order to have a strong conversation, and as with our past Price Talks, if you have questions, please send them in to Harley, and she's going to manage those for us. And while we may not have time to go over all of the questions today, if your questions weren't answered in the Q&A that others have posed, please do send them in anyway, and we will try to provide responses where we do have data. And I think that's one thing that you're going to hear throughout today's conversation. In many ways, one of the challenges that we face in the homelessness service area, but in all of the areas, is that it's very difficult to get real-time data aggregated so that policymakers can make those decisions on an ongoing basis. Despite the lack of real-time data, I thought it still would be useful to provide some basic description of the homeless population here in California and in Los Angeles as of the last data points that we have, which is 2019, to really help inform why the policy options that we're looking at are relevant and how vulnerable the homeless population really is and why they are a particular risk. So just if you'll bear with me for a few moments, I wanted to give you a sense of that. And so in 2019, the data suggested that there was about 150,000 homeless people here in California and close to 60,000 here in Los Angeles County. This represents a lot of growth in the homeless population over the last decade. Homelessness in California has grown more than 22% over the decade, and actually 15% in the last 3 years. And this contrasts pretty dramatically to the homelessness in the United States, which grew at only about 3%. One of the particular features of the homeless population that makes them particularly vulnerable, but very different in contrast to places like New York City and so forth, is that the majority of our homeless population in California and in LA County are unsheltered, meaning they're living on the streets in some sort of encampment or directly facing the elements themselves. This actually represents over half of the homeless population in the nation. And so to the point of the state, 72% of the homeless are unsheltered and 76% here in LA County are unsheltered. And what we see among the unsheltered is that they face more significant health challenges, violence and trauma, and actually longer lengths of exposure to homelessness than those staying in shelters because they're not getting connected to services that they might need. Unsheltered people also engage the police more frequently in emergency health services. And so to that end, it actually describes why they are more vulnerable because of their exposure to the streets. The thing about constructing policies for the homeless here in the pandemic is that you have to appreciate that the homeless are not homogeneous, they're not the same. Those people you might encounter on the streets could have been homeless a long time or a very short time. And so just to give you a sense of this, I'm going to define the chronically homeless population as the population who's been homeless for more than a year and also have some sort of health or disabling condition. And the newly homeless, people who have been homeless less than a year, who don't have necessarily those conditions, but they may also have those conditions. And you see quite different challenges that those two populations face. In LA County, 28% of the homeless population is chronically homeless by that definition. And the chronically homeless population is more than twice as likely to face various kinds of health issues. So for instance, 15% of the newly homeless note that they have some sort of addiction issue or a mental health challenge, but 32% of the chronically homeless say that they have one of those two issues. As it relates to health, newly homeless individuals, 8% note that they have a physical disability or a physical health challenge of some kind, whereas the chronically homeless cite at a rate of 16% that physical condition, that health condition, is one of the primary drivers of becoming homeless. In contrast, economic reasons are a vast driver of homelessness here in LA County. We'll talk a little bit more about that later. But we see that among the newly homeless, 57% of single individuals and 71% of families cite economic reasons as the primary driver of becoming homeless. For the chronically homeless, that number is still high at 49%, but it's not as high as for the general population. And the last thing that I think is important to appreciate among the homeless population is that it's not representative of the overall general population. In particular, both Black people and Native populations are overrepresented in California homelessness. And that has important implications, again, for how we assess risk and how we craft policies. So among the Black population, or sorry, I should say among California's general population, there are 6.5% are African American, but among the homeless population in California, it's almost 30%. Among Native populations in California, Natives represent only 1.6% of the population, but 4.5% of the homeless population. So you can see that these rates of disproportionality are quite high. So as we're thinking about a policy response to the pandemic, we have to appreciate why there are so many homeless people. And in 2019, the primary reasons were in some ways somewhat straightforward. We could actually understand them. And there have been numerous reports that have identified why so many people were homeless. The first thing that comes to mind is constrained housing supply. We know that various estimates deem that California has an affordable housing shortage of about 1.4 million homes. We saw that the economic reasons were driving first-time homelessness. So this was quite clear. A second piece of this is that incomes among low-wage earners have not kept up with the housing costs, and that creates what we call severe rent burden, meaning that more than that, or just for example, I should say, in LA County, there's 30% of households that are paying more than half their income as rent. So this combination of high rents and low relative incomes is a primary driver to homelessness. But the third reason that doesn't always get discussed as broadly is that there's evidence of systematic and institutional racism, and that's why we see disproportionality among especially the Black population here in LA County. And it's not one form of discrimination, but it's across a wide variety of systems, and that's why it's called systematic racism. And so you might see the engagement with a landlord providing some level of discrimination, but then there's also history around redlining and exclusionary zoning and so forth. The implications of this racism does not just extend to housing, but also results in employment discrimination that leads to higher unemployment rates for Black individuals, and it also leads to lower wages. So in this context, it immediately, with that in mind, I should say, I'd love to turn the talk a little bit toward the pandemic. So as the pandemic descended, the two populations that people most talked about in terms of being at risk were those who were incarcerated and those who were homeless. And the reason for that is fairly straightforward. People who were living in congregate settings, who had risks associated with living in those congregate settings, being exposed, and not having the same sort of access to healthy food, sleep, hand washing, social distances, etc., made us, rightly so, quite worried about these populations. The other kinds of risk factors are that the homeless population is becoming increasingly older. Over the next 5 years, it's projected that the population over 65 that's homeless is actually going to increase by about 50%. And so with this in mind, there was a report that was put out by Dennis Culhane and his colleagues trying to assess what it would take to really, in some ways, prevent the homeless from experiencing what was feared in terms of exposure and so forth. And what they estimated was that it would have cost an additional $11.5 billion nationwide to produce the necessary 400,000 new shelter beds in settings where physical distancing was there, to create the appropriate kinds of quarantine location for those who are sick and exposed. This is a huge number. Now, this number was based on assumptions that policy, both local and state and even federal, was not going to change from what it looked like in February. Fortunately, it has changed since February. And so, for instance, in LA County, we haven't seen an extreme outbreak among the homeless population at this point, which is good. In part, we haven't, tested as much as we ought to, and this is a refrain that we see not just among the homeless population, but a broader population as well. Last time I've looked at the data, there's been about 30 homeless people that have tested positive for COVID-19. Most of those were living on the streets. There was actually 6 that tested positive at a Skid Row shelter. But it is impacting the workforce and other places. So the Union Rescue Mission, you might have seen, actually had to cut capacity from 1,000 beds to 500 beds after 5 of their staff members were infected and 1 staff member passed away from COVID-19. And as of yesterday, we're seeing that the city is deploying street medical teams to actually more systematically test for COVID-19 and also to distribute hygiene supplies and educate around social distancing protocols and so forth. San Francisco, for instance, actually had a large outbreak at a homeless shelter where more than 100 people tested positive, including 10 staff. So what has been proposed, what's being done, and what ought we to think about in the next few months as we're still going to be dealing with this pandemic, but also dealing with the implications of the economic shutdown that were caused by the pandemic. So one of the programs that many of you have probably heard about is Project Room Key. So Project Room Key is a program here in California where the state of California is trying to secure 15,000 hotel rooms that are currently vacant because of the economic shutdown, explicitly for people who are experiencing homelessness as a way to reduce spread and to protect those who may have been exposed or are at high risk. So specifically, there are 3 types of individuals they've identified for these hotels. Individuals who currently have COVID-19 but don't need to be hospitalized so that they can quarantine and heal. Individuals who've been exposed to COVID-19, even if they don't have symptoms of any kind, and even if they don't have a test, but they need to quarantine, they're also eligible for the hotel rooms. And then finally, high-risk individuals, people over 65 years old, or have pre-existing conditions. And as we noted, many people who are living on the streets who are chronically homeless actually do cite a variety of health conditions that would qualify them for living in the hotel rooms. And as of April 12th, 10,500 roughly rooms have been secured of the 15,000. And as of the last press conference that I listened to from the governor, he noted that 37% of these approximately 10,500 rooms are currently occupied. And we can talk more about that in Q&A as to why is it 37% and not 100%. And so what's going on with that and what are the challenges there to identify the right people for those rooms. So what this does, not only providing people shelter, but it also provides people wraparound services. And currently, the federal government is going to reimburse state and local governments up to 75%. The leases in these hotel rooms are somewhere between 2 months and 3 months, and then they have the opportunity to extend those leases in most cases. And then states could ask for additional FEMA money to fund, again, up to 75% of these expenses. So that's one of the major initiatives that probably many have heard about. Another area where you've heard a lot of discussion is how do you increase just the number of shelters that exist in one form or another. So you saw that in some cases, the current shelter system is oversubscribed in the sense that you aren't able to maintain physical distancing unless you actually change the physical infrastructure of those shelters. And so what you're seeing is reduction in the number of people at any individual shelter and new shelters being open. So you have heard about the city of Los Angeles converting up to 42 rec centers into shelters that would have the mandatory physical distancing, which would be appropriate. If they open all of them, this would provide up to 6,000 beds, and they will continue to open them as needed. They've also extended the winter shelter program beyond its normal ending with the season. And this action provides over 300 additional beds for people who are experiencing homelessness. The other kind of policy action has been to deploy many more hygiene stations, 300 new mobile hygiene stations and 18 shower facilities throughout for people who are currently living outdoors. So those are where most of the current policy actions live. But policymakers, researchers, and others who are focused on the homeless population are thinking about looking forward, because to date, what I've talked about are those who are currently homeless. But one of the big concerns, given the fact that newly homeless are typically driven there because of economics, we have this economic shutdown that is, putting a lot of people at risk. And so we're currently thinking about how can we best address that kind of ongoing potential kind of wave of new homelessness. Now, we have seen action at the city and at the state level where people have enacted moratorium on evictions and foreclosures of various kinds. And so this should provide temporary relief. But the question, remains, well, what will be done when that moratorium ends? There have been other sorts of provisions around rent control at the state level and also just cause eviction that should slow down the ability for landlords to evict tenants that aren't able to pay. But again, what's going to happen when COVID-19 is done? And the final issue that comes to mind that hasn't received a lot of attention because of the crisis, which has focused primarily on just how do you get anybody into the right place so that they aren't going to be a danger to themselves or to others, is these issues around systematic and institutional racism that is a key driver to people becoming homeless. And in particular for the Black population, the fact that they are homeless, even if they aren't presenting the same sort of risk factors that one would expect, could end up with some challenges with respect to how people get placed in what particular short-term or long-term setting. One of the real issues, that we're going to then confront is once we have COVID wane, but we have people in these contexts, hotels, new shelters, etc., what are we going to do as a community to make sure that people can be moved to permanent housing? So the answer certainly won't be found in a very short amount of time, but it's going to have to be thought of very carefully so that you can step down, just like you do when you have a flood or like Hurricane Harvey in Houston. When you move people from temporary housing, how do you get them into permanent housing? And so those are decisions that policymakers are grappling with on a daily basis, but oftentimes policymakers are focused on the immediate because the crisis is so real and immediate. But a group of us ought to be thinking about what happens 6 months, 12 months, and 2 years from now. So with that, I'll pause and let Harley share some questions.
Sounds good. So the first one was emailed to me, and it says, I do personal outreach to the homeless by creating bags of food and sun-dried items, and I hand them out. I do quite a few. I've been doing this for over a year, and I've been frustrated that I can't do it now. I'm very tempted to start back, but I'm scared, and I'm not scared for myself, but more for infecting other people. I'm wondering when it might be safe to resume, and if you have any ideas on how I can distribute these bags until lockdown is over.
I think the best thing to do is to listen to our healthcare professionals and those who are at the county and city agencies to give guidance about how best to engage. As you can appreciate, LAHSA, the Los Angeles Housing Service Authority, has issued guidance for service providers currently, and so they are being restricted in their ability to engage with homeless populations in the way they had as well. And so at this point, it's probably the best thing to do is to contact those folks at LAHSA or other county or city agencies to find out when is the best time to actually provide that. It can be the case that instead you might be able to work with a service provider who already has an outreach worker out in the field, and that they might be able to do those deliveries.
Okay. The next question is, what kind of funding do they have for projects that are in the pipeline?
So I guess in some ways it was advantageous that 3 or 4 years ago, Measure H at the county level and Measure Triple H at the city level were passed to provide funding for permanent housing and also for the kinds of wraparound services that were needed. A lot of people over the last 2 years were wringing their hands at the fact that a lot of this housing hadn't been opened yet. And that's a reality because it takes oftentimes 3, perhaps even up to 5 years to actually build housing, especially in our dense communities here in LA County. So what's going to be happening in the next 2 or 3 years is that you're actually going to see somewhere in the range of 12 to 15,000 units opened from those allocations of Measure Triple H, and also some of the temporary and hopefully permanent state funding that is expected. So there will be housing coming online that the people who are living in hotels, motels, and or these congregate shelters would then be able to occupy. What we don't know, and this is the real concern, is how much the economic shutdown might cause a new wave of homelessness. And so when the planning was associated around how we're going to allocate those dollars for building housing and the new services, it was really thinking about the population as it was, for instance, in 2019, somewhere between 50 and 60,000 in any particular point in time. But if we do get a new wave, then we're going to have to deal with that if it comes.
Okay. Next question is, are there emergency programs in place to make up for lost meals now that NGOs are backing off of providing food due to the coronavirus?
So I don't know the specific answer to that question because there's been so many different kinds of food programs and so forth. One of the challenges in this crisis, is logistics, in fact. And so one of the things that the city, for instance, had to figure out with the rec centers is the rec centers were never places where food was distributed before. How do you actually get food there? And so what I've been seeing is that the city and the county have been doing a pretty good job of figuring out how to bring the food to the places where people are. However, it's not the same as it was before. And we've seen that with respect to school meals, right? So at first people thought the best thing to do might be just to have the kids all come to the school. But then they found in many schools that wasn't the best thing to do. And so people are continuing to experiment and kind of pilot new solutions to actually deliver food, for instance, to the populations who most so desperately need it.
The next question is, what about Latinos and homelessness?
So as was kind of noted before, the Black population is overrepresented in homelessness, but in the past, the Latino population was not overrepresented in terms of those becoming homeless. However, over the last 3 years, you've seen a pretty large uptick, and I should say last 3 years again, I should be clear, 2017, 18, and 19 in the number of Latino individuals and households experiencing homelessness. And that's because there was a very strong correlation between the uptick in people becoming homeless for economic reasons and Latino households becoming homeless. And so in many ways that increase, although still not disproportionate with the number of the overall population among Latinos, is of grave concern, because in the past, Latinos and others who had, or immigrant populations in general, and of course not all Latinos are immigrants, but some were, you tended to see people living within other households or friends in situations where there may have been overcrowding, but people weren't living on the streets. In 2018 and 19, we started to see that system of support start to fray. And so that was a big concern. And so a lot of research and research that we're conducting at the Price Center for Social Innovation is trying to uncover how that frayed system of support has been impacted by this increasing distance between what people are having to pay for rent and what their incomes are.
How much will be spent on people experiencing homelessness because of COVID-19?
It's unfortunately a question I don't have the data on. What we did have is just that kind of report that if you actually took nationwide, it would cost $11.5 billion to house 400,000 new people in new settings appropriate, related to the physical distancing that would be required. However, we have had policy changes broadly, so the social distancing that's happening in the general population also protects the homeless population, so that turns out to be an upper bound. But in terms of what it's going to cost here in California, I don't think we have a good sense of that. Project Room Key, I don't know if we have any estimates on that yet. I'm looking at my notes and I don't see any estimates on what people are projecting on that one.
That's good, because that was one of the next questions, so I'll just skip over
Okay.
that one. What do you anticipate will be the effect of the virus on funding sources for assisting the homeless? Examples, measures in LA County state funding.
Well, I don't know if there will be a direct correlation between funding the homeless versus kind of COVID-19 response funding. I think the biggest potential trade-off that people are worried about is just the fact that our local governments are going to have much less money altogether. And so before COVID-19 hit, there was a lot of important conversations about what was needed to fix our ailing housing market. And some of that entailed new ways that we regulated the housing market, but some of it actually entailed new money that would go to funding and so forth. So what I'm concerned about is that new money that could have helped kind of provide gap funding around permanent supportive housing or other things is going to be eaten up in that context. One of my colleagues just shared some information on Project Roomkey, and we're anticipating it to cost $150 million across the state. And again, FEMA is scheduled to reimburse 75% of that, but we don't know if once leases are renewed, if that will in fact continue to be reimbursed at that higher rate.
Okay, I'll try to get through as many questions as we can.
Yeah.
It sounds like a lot of the pandemic solutions are aligned with common sense support systems for people experiencing homelessness regardless of COVID-19. Is that accurate? What is most different between pre-COVID priorities for the homeless and what is being advocated for now?
So I agree with the premise of the question, which, that it is common sense to move people from the streets to being housed in one setting or another. And if we had enough resources, you'd want it to be in settings that were permanent. But if we don't have enough resources to do that immediately, then you want it in settings where people have a path to permanent housing. So in that context, yes, you have the same basic kind of premise at play. It's a human dignity, it's human right. However, what's different about COVID versus non-COVID is that those settings, especially those settings which are not permanent housing, but even some of the settings which might be. So for instance, you might be living with your roommate and you might have two people in a room. In the context of COVID-19, you might not be able to do that anymore. Either you aren't able to do that, and certainly, we might not be able to house people who are formerly homeless in that way. So that's the biggest issue, is that the structure, some of the infrastructure we have, will actually have reduced capacity, which would require even more infrastructure to provide necessary beds and housing.
Okay, we'll try to get through like 3 more. I work with a 12-staff nonprofit in South Central LA who wants to be a resource for the unsheltered. How do we get started, and where is funding to launch such an initiative?
Well, as I think people appreciate right now, a lot of nonprofits who are doing a lot of amazing things in our community are hurting. And so what's probably best in the short run is to partner with existing nonprofits that are connected to have actually some government funding to help supplement private philanthropic funding. In the short run, that'll actually be the most effective, rather than to kind of start a brand new nonprofit in a particular area. In a few months, there might be the right time to do that, because the kinds of services that a new nonprofit might provide might not currently be in the landscape. But my suggestion now would be to work with those who are already doing work in the community, figure out how to partner alongside them, because they'll have more developed networks and trust with both within the community, but also within have access to funding sources.
Okay. How would you explain that there has not been a high rate of COVID cases in the homeless population, given their high-risk status and challenge in sheltering in place?
I don't think we have a great sense of why. In some cities, you've seen outbreaks in the homeless population. In other cities, you haven't. There's nothing special about Los Angeles, where we've only had 30 cases, in San Francisco at 100, for instance, in one shelter. What we know about COVID is that when it hits, it can multiply very quickly. We've seen that in some homeless populations throughout the country. We've also seen it in jails and prisons. And so, what we as policymakers, as a community, need to do is to remove people from situations where there is extreme risk. And that's what we're pushing forward to do with respect to the current set of policy interventions. But also we need to think hard about that. I think going forward, one of the things that's absolutely true for the homeless, but also true in the general population, is for us to think seriously about testing. And I was very heartened to see that they're starting to much more randomly test the homeless to get a better sense of who might be contagious, and therefore isolate those people into the hotel rooms, since we have capacity there.
And that'll be the last question, which was going to be, have there been a proactive effort to test the homeless population with COVID-19 in LA County, and how confident are public officials in the current number of cases for the homeless population inside and outside of LA?
Well, I think that from my understanding, it's just been very recent, the last week or so, where there actually has been much more proactive efforts. Some of the evidence from the USC Price and LA County study, which did a random sample of people, suggested that the rates of COVID exposure are much higher than we get just by the reported confirmed cases. And so with that in mind, it's essential to know could be an asymptomatic carrier of COVID-19 so that they can be isolated and those who are exposed to them can be isolated. And so I think it's absolutely essential that we are able to move forward with more random testing so that we can actually protect those who have potentially the virus and those who might be exposed to it from people who they're close to.
Well, thank you all so much for joining us today for today's session. The questions that we did not get through, I will keep them and share them with Gary, and we will post some of them on our website. And we hope to see you for the rest of the Price Talks later this week. We have one tomorrow and one on Thursday. Thank you all.
Thank you, everybody.